Okay, welcome back. Dr. Lidney here. We are going to be uh, looking at the microscopic anatomy of muscle. And when we do that, there are some terms and some anatomical landmarks that you need to be familiar with. So we know that muscles attach to bones. But how do they attach to bones? This is a great visual. So muscles attach to bones by way of tendons. So when you hear of someone tearing a tendon, it's not the muscle that's ripping, it is the tendon off of the bone. What part of the bone do tendons attach? Remember that layer around bones? That's called the periosteum. The periosteum. So muscles transmit their contractile force into the tendons, which are more inelastic, and then the tendons tug on the bone and the bone moves. Okay. Here we see a muscle fiber cell. Here we see an endomysium. We see fascicle, the term fascicle. So we're going to go over endomysium, fascicle, perimysium, and epimysium. Let's take a look at these terms. So here is an endomysium. And when you have a bunch of these, let's see if we can look at them here. Each of these small each of these muscle fibers, I should say, right? Each of these muscle fibers are surrounded by this layer called an endomysium. Okay, so a bunch of these are referred to as an endomysium. And if we take a look, each of these endomysiums, here's another one, here's another one, here's another one. Each of these are surrounded by a fascicle. So we could see right here, here's an individual endomysium, and right here is a fascicle. Now, when you get a bunch of these fascicles, so let's say here's a fascicle, here's a fascicle, here's a fascicle. What surrounds each of these fascicles is what we call a perimysium. So right here is a perimysium. So you have each of these endomysiums that are grouped around, endomysium, endomysium. You have a bunch of these endomysiums that are surrounded by this perimysium, okay? This layer around here. Now you have all of these that are surrounded all the way around by its epimysium, okay? So those are the three main layers that are surrounding muscle. So the smallest muscle fiber, that small portion, we have these muscle fibers, and each one is surrounded by an endomysium. When you get a bunch of these endomysiums, they're surrounded by what we call a perimysium, but this is also one fascicle. When you get a bunch of these fascicles, they're surrounded by an epimysium all the way around. Okay, so you'll see that the skeletal muscle fiber is made up of individual cells. Those are called muscle fibers. Each muscle fiber is surrounded by a connective tissue called an endomysium. We have a group of 10 to 100 muscle fibers surrounded by perimysium. That's called the muscle fascicle. When you have a bunch of those muscle fascicles, and they're surrounded by an epimysium. Okay, some other terms to know. We already covered tendons. We know what tendons are. That's just the attachment of muscle to bone. What is it called when you have a soft tissue structure going bone to bone? It's called a ligament. When it's muscle to bone, we call it tendon. A broad, flat tendon is an aponeurosis. Okay, so an aponeurosis is a tendon It's just a broad, flat tendon. When you do some of the muscles of the skull, around the face and the skull, there's a muscle that is called, you'll see the frontalis muscle, and then you'll see an occipitalis muscle, and you'll see that they attach through an aponeurosis. When you look at the latissimus dorsi, a very, very large muscle, the origin is on what's called the thoracolumbar aponeurosis. Thoracolumbar aponeurosis, because the tendons originate on the thoracic and lumbar spine. Now, what is fascia? Fascia is this fibrous connective tissue. It's beneath the skin, and it surrounds everything. It surrounds your muscles, it surrounds your organs, your blood vessels, your nerves. It really does cover everything. If you are a carnivore, if you've ever eaten a piece of chicken or let's say a leg, when you peel off the skin, you can see the muscle. But before the muscle, there's this thin, translucent, clear layer that covers the muscle that is called fascia. Okay, when I come back, I will get into the neuromuscular junction.